we're going to talk about some immunization updates for 2021. Again, I am Dr. Arlette Sanchez Samaniego from the Department of Community and Family Medicine of FEU NRMF Institute of Medicine and Medical Center and Ilocos Training and Regional Medical Center. The 2021 updated immunization schedule, which is in tabulated form, is not yet available at this time, at this time of presentation, but it will soon be available in the CDC Morbidity and Mortality Weekly Report for February 2021. The severity of SARS-CoV infection is graded into mild, moderate, and severe. But we want to develop a vaccine so that we would hope to prevent transmission, prevent clinical disease, that is a clinical efficacy, and prevent severe disease. That way, we may only have mild or even just moderate COVID infections. The available vaccines in the market today, some of which are the Pfizer, Moderna, and AstraZeneca, and the Sinovac vaccines. There is also a Russian preparation and another one being developed by J&J. But so far, these are the statistics available to me. So as far as clinical prevention of clinical disease is concerned, the Pfizer vaccine provides 95% protection, Moderna 94%, the AstraZeneca vaccine 62 to 90%, and Sinovac 50 to 91%. As far as prevention for severe COVID-19 disease, yung naman ICU, it appears that there is 100% effectiveness for the AstraZeneca vaccine, Moderna, and the Sinovac, and about 89% for the Pfizer vaccine. Herd immunity. We don't know yet whether we will be able to produce herd immunity, because herd immunity will be accomplished when we are able to also accomplish prevention of transmission through the vaccine. So this is a wait-and-see situation. When the vaccines are finally available, maybe in a month's time, the DOH strategy for the administration of vaccination would be as follows. Please note that the COVID vaccines are not available commercially. It is only available through tripartite agreements between government to government. And at the moment, the vaccine companies are selling their vaccines at cost, with agreement that when the pandemic has tided over, they will be able to sell the vaccines at more reasonable prices as far as their business is concerned. So at the moment, we are not able to purchase in our private clinics for our private patients, because this is only available in government through government-to-government agreement. So the DOH vaccination strategy would be as follows. That is to be able to maximize the distribution and utilization of the vaccine, because there's not enough for the whole population of the Philippines or even the world. So the first group would be the essential healthcare workers or frontliners and uniformed personnel. Initially, it was just the essential healthcare workers, but now they're including the uniformed personnel, because the uniformed personnel are also very, very much exposed to crowded areas, and for them to be able to function in the national level, then they would have the same priority as essential healthcare workers, followed by senior citizens, and then by the indigent population, and then finally the others that are not classified above. The ACIP, or the Advisory Committee on Immunization Practices, in December 2020 had a similar strategy, focusing initially or first on the frontliners, and then followed by the elderlies. This is actually the priority geographic regions in the Philippines, Okay, so the distribution for indigent populations will be dependent on the number of confirmed cases in the various areas of the Philippines. You will note that the NCR has the highest number of cases. Now we shift to flu vaccines. Okay, so there are many flu vaccines that have been developed for this year. Notedly, we have a recombinant anti-flu vaccine, which is the flu block. However, this is not yet available in the Philippines at the time of this presentation, but it is already available in the United States. There is a lot of emphasis on flu vaccines because part of the classification of COVID suspects or probable cases will be classifying them to be on the ILI or the influenza-like illness. So we want to vaccinate our patients with flu vaccines so that we will have decreased cases of flu, and then we will not be able to confuse them with COVID infections, or at least in the initial stages of the COVID infection. So flu vaccines, dose and volumes for children age 6 months to 35 months. Okay, so these are the listings of the different flu brands. What would be common in this list for the Philippines will be the Fluarix quadrivalent vaccine. Okay, so for 6 months to 35 months, 35 months will be equivalent to 2 years old and 11 months. Okay, so they should be receiving a full dose of Fluarix quadrivalent vaccine. So 1 vial of Fluarix quadrivalent is 0.5 ml. So the patient should receive the whole dose if they are 6 months through 35 months. Also, patients who are 2 years old and above may receive the LAIV4 or the live attenuated influenza vaccine, which is given intranasally at 0.2 ml. Okay, that is 0.1 ml in each nostril. However, this preparation is not available in the Philippines, but it will be noteworthy to know this so that if you have patients who are expats and they have available preparations with them, then we would know how to administer them. Emphasis on the age of 2 or more because this is not licensed. This intranasal live attenuated influenza virus vaccine is not licensed for children aged less than 2 years old. Now, so care should be taken to administer an age-appropriate vaccine at the appropriate volume for each dose. That was listed in the slides I showed you two slides back. Okay, for the inactivated influenza vaccine, the needed volume may be administered from a pre-filled syringe containing the appropriate volume, and that is of course determined by the manufacturer, a single-dose vial or a multi-dose vial. Now, for multi-dose vials containing 0.5 ml, they should be used or accessed only for 1 dose. Okay? Do not half the dose and then the remaining will be given to another patient. If, let's say, for example, you will recall that in the previous slides, there will be, if I will just move my slides two slides back, I cannot do that. It won't. Okay, so, but if you will recall the 2 slides earlier, there were flu vaccines that will be given at 0.25 rather than 0.5. So if you have a 0.5 ml vial like the Fluarix, which is available in the Philippines, you cannot half that, okay, and give 1/2 or 0.025 to one patient and another one to another patient, okay, because again, okay, the administration of flu vaccines for 2020-2021 is to give the age-appropriate vaccine at the appropriate volume for each dose, and Fluarix, which is included in that list and is available in the Philippines, is actually recommended to be given at a single dose of 0.5 ml or 1 full vial for 6 months to 35 months. So 35 months is about 2 years old and 11 months. Should you have in your possession the multi-dose vial, sometimes they are good for 20 or 15 doses, okay, regardless of the volume of the doses taken or any remaining volume in the vial, you should only use it for 10 doses, okay, because they feel that after the 10th dose, the chance of infection and the breaking of the cold chain is already present. So for multi-dose vials, regardless of the volume per bottle, you should only use 10 doses in any of the multi-dose vials. Okay, any vaccine remaining in the vial after the maximum number of doses, which again is 10 doses, the leftovers should be discarded. Now, let us change the age group. This time, 6 months through 8 years. Okay, patients who are 6 months old up to 8 years old will require 2 doses of influenza vaccine administered for a minimum of 4 weeks. So it can be longer, okay? 4 weeks apart, and this should be given on the first time that they are going to receive the vaccine. So this is only for patients 6 months to 8 years of age. They are required to have 2 doses, sana on the first time that they are going to receive anti-flu vaccination. And the interval should be 4 weeks. You will recall that in our previous lectures, okay, viral vaccines should have a minimum of 4 weeks interval between doses or between any antiviral vaccination. Again, for this age group of 6 months to 8 years old, okay, those who have previously received 2 or more total doses of either the trivalent or the quadrivalent influenza vaccine with an interval of equal to or more than 4 weeks apart before July 1, 2020, which is the last year, require only 1 dose for 2020 to 2021 season. Meaning, if your child has received, in this age group, 6 months to 8 years, has received 2 or more for the initial dose nga, no? Or at any one time in July 1, before July 1, 2020, then your child will only receive 1 dose of anti-flu this year. The 2 previous doses of influenza vaccine do not need to have been administered in the same season or consecutive seasons, meaning baka nung before July 1, one was given in 2019, the other one is given in 2020, so that's 2. They don't necessarily have to be given in the same season, okay? Or maybe, let's say, one was given in 2018, the other one is you did not give anything in 2019, and then the next flu vaccine is, let's say, May 2020, then you will only require 1 dose for 2021 season or after July 2020. Okay. Those who have not been previously received, so again for 6 months through 8 years, those who have not previously received 2 or more doses of trivalent or quadrivalent influenza vaccines and not at 4 or more weeks apart before July 1, 2020, or whose previous influenza vaccination history is unknown or unrecalled, then you will require 2 doses for this year. Okay? So kung hindi nabigyan ng 2 or more, tapos hindi rin o nabigyan ng 2 pero hindi naman pala 4 weeks apart, before July 1, 2020, they will require 2 doses for this year. The interval between the 2 doses should always be 4 weeks. So we have been repeatedly saying this in all our lectures on immunization. Viral vaccines should have at least 4 weeks in-between interval, at least. So pwedeng matagal, pero hindi pwedeng mas maikli. 2 doses are recommended even if the child turns age 9 years between receipt of dose 1 and dose 2, meaning, okay, because our recommendation for 2 doses is 6 months to 8 years. But if, let's say, for example, the patient received the first dose at 8 years old, and you are going to give the next dose next month or 4 weeks later, pero 9 years old na siya next month, you still will have to give the dose number 2, even if the patient is 9 years old. Kasi yung dose 1 mo ay binigay mo 8 years and below. Okay. Adults and children aged 9 years old and above will need only 1 dose of influenza vaccine for 2021, even if they have not received anti-flu before or whether they only received 1 dose before July 2020. Okay? So the age is very important. Flu vaccine in pregnancy and in the postpartum is required because postpartum women and pregnant women have been observed to be at higher risk for severe illness and complications from influenza, okay, particularly in the 2nd and the 3rd trimester. But remember, the flu vaccine that we have to give to these pregnant and postpartum women, or I mean, at least for the pregnant women, should be the inactivated anti-flu vaccine, which is your injectable. Actually, wala naman tayong live attenuated, no? Because the live attenuated influenza vaccine is the intranasal, which is not available in the Philippines. But we emphasize that it has to be the inactivated anti-flu vaccine for pregnant women. Now, for older adults, that is 65 years old and above, okay, any age-appropriate inactivated influenza virus vaccine formulation should be given, whether it is a trivalent or a quadrivalent, non-adjuvanted or adjuvanted, okay, or the very new recombinant influenza vaccine, or the RIV4, in the brand of Flu Block, okay, which is only available in the States at the moment. Okay, so any brand, pwede naman, ng inactivated influenza vaccine, okay? Now, the Advisory Committee on Immunization Practices, or the ACIP, recommends that for immunocompromised patients, okay, those who would have congenital and acquired immunodeficiency states, those who would have active malignancy, uncontrolled or unstable HIV persons living with HIV, okay. So those patients who are receiving immunocompromised or patients who are immunocompromised due to medications, like those who are using very high dose steroids, okay, or even persons with anatomic and functional asplenia, should receive the age-appropriate inactivated influenza virus vaccine or the new recombinant influenza vaccine. Okay, so not the live attenuated. Furthermore, the immune response to influenza vaccines might be blunted in persons with some conditions, like, again, congenital immune deficiencies, because the immune system will not respond to the antigen-antibody reaction appropriately, or for persons receiving cancer therapy or immunosuppressive medications. Okay, so this will also include not only for the immunocompromised, but also for patients who are using very high-dose steroids. Okay, a history of Guillain-Barré syndrome, or GBS, within 6 weeks of a previous dose of any type of influenza vaccine, be it the inactivated or the live attenuated, or now we have the recombinant influenza virus vaccine, okay, then if you observe this 6 weeks after the a previous dose of anti-flu vaccine, then you have to be very cautious in giving again flu vaccine. As an alternative, if you're afraid that because you have to be cautious about this, if you're afraid or you want to be more cautious, then you do not give the anti-flu vaccine. Instead, you may want to consider giving the influenza antiviral chemoprophylaxis for these patients. I do not know the chemoprophylaxis that is recommended. I have no experience, but at least theoretically, this is an option. If patients has egg allergy, okay, because you see the current influenza vaccines, even the recombinant influenza virus vaccine or the flu block quadrivalent, okay, and even our Flucelax, okay, actually are egg-based. They prepared the virus in embryonated eggs, and therefore this may cause some allergy to patients who have egg allergy. So you have to be very careful. But if you have to give this to patients, kasi yung iba naman kahit may egg allergy, no reaction to these vaccines, no? So it is recommended by the ACIP na kailangan andyan lang yung pasyente, let them sit down or let them lie down when you are having injection, and do not dismiss them immediately. You may want to wait 15 minutes. Our practice in our institution is to make the patient wait, okay, for about 30 minutes, okay, so that you can see whether there will be allergic reactions and you can deal with it more promptly. For travelers, of course, mahirap mag-travel ngayon, but if you should travel, okay, travelers who want to reduce the risk for influenza should consider influenza vaccination at least 2 weeks before their departure para magkaroon na ng reaction, magkaroon na ng antigen-antibody reaction. Because if you're leaving the day after the vaccination, then the antigen-antibody reaction has not reached its optimum. Okay, so 2 weeks, at least 2 weeks before departure. Now, just to note, okay, the flu season in temperate climates, okay, in the northern hemisphere is between October to May, and in the southern hemisphere it is April to September. In the tropical areas, practically the whole year, but in the Philippines, between July to August is going to be the maximum flu season, and then we have a second wave sometime in December and January. Persons at higher risk who receive the previous season's vaccine, that is the 2020 vaccine, before travel should consult with their healthcare provider to discuss the risk for influenza or other travel-related diseases before embarking on travel during the summer. What this means is, because let's say if a patient coming from the United States is going to come and visit the Philippines, our flu seasons are of different times, okay? So you have to consult your physician, okay, whether the strain of your area is the same strain of flu in the place of destination, so that you know whether you are protected or not. Although if you're going to use the quadrivalent, that is going to be less of a problem. All persons, regardless of risk status, okay, vaccinated before travel should receive the current vaccine the following fall or winter. In applying to the Philippines, okay, we have a flu vaccine that is available from Sanofi, okay? Siya lang kasi yung anti-flu vaccine sa Pilipinas na the expiration date is January 2021. Okay, if you're talking about the flu vaccine of last year. All the other flu vaccines have a marked expiration date of December 2020. But it's only Sanofi with a January 2021. Meron ako mga pasyente, hinahabol nila yung anti-flu. So if you administered the Sanofi vaccine in January 2021, okay? And then, lalabas halimbawa yung flu vaccine for 2021, okay? Dapat makareceive pa rin siya ng anti-flu for 2021 provided you have at least 4 weeks interval between the two vaccines. So they still have to receive that. Now, as far as flu vaccines with other vaccines, the inactivated influenza virus vaccine and the recombinant influenza virus vaccine may be administered concomitantly or subsequently with other inactivated vaccines or live vaccines. But then again, please observe a 4-week interval. Okay? So no contraindication to combine or to be followed by other vaccines. But let me just remind you, provided there are 4 weeks interval between the vaccines given separately. The live attenuated influenza virus vaccine may be administered simultaneously with other live or inactivated vaccines, provided, again, administered simultaneously. So if you're going to have two live vaccines or 1 live and 1 inactivated vaccine, it doesn't matter, okay? But they have to be given simultaneously. If they are not given simultaneously, you have to observe the 4-week interval. I remember attending one symposium and one infectious disease specialist said that no two live attenuated vaccines should be given together, okay? So let me just clear to you that our position now is you can give 2 live attenuated vaccines together, provided they are given simultaneously, not successively. That is also true for live attenuated and inactivated vaccines. Either together or you wait for 4 weeks minimum. Now, if 2 live vaccines are, well, I said this earlier. So if 2 live vaccines are not given simultaneously, then after administration of 1 live vaccine, at least 4 weeks should pass before another live vaccine is administered, or you give them together. Vaccination should not be delayed to obtain a specific product when an appropriate one is already available. You will remember last year na ang hirap makakuha ng quadrivalent vaccine, no? Nawala sila for a while. So what was only available was a trivalent. So if your patient needs protection, you don't have to delay and wait for the quadrivalent. Okay? Pwede na yung trivalent. Okay? All right, so you don't have to wait. Within these guidelines and approved indications, when more than 1 type of vaccine is available and appropriate, no preferential recommendation is made for the use of any one influenza vaccine over another. So, pantay-pantay lang tingin natin sa kanila. Quadrivalent live attenuated influenza virus vaccine should not be used in children, again, less than 2 years old, or in patients who are pregnant or who have received antiviral medications. Okay? The interval will be dependent on what antiviral the patient is receiving. If it is oseltamivir or zanamivir, dapat hindi magbigay ng live attenuated influenza vaccine for 48 hours. Okay? If it is peramivir, dapat magintay tayo ng 5 days. If it is baloxavir, then we have to wait for 17 days. Okay? But at the moment, this is not going to be our problem here in the Philippines because we do not have a live attenuated influenza virus vaccine. All right, so we have enough emphasis on the updates for flu vaccine. Now we shift to Tdap. You will recall again that in the earlier lectures that we gave, the initials T, D, and P, whether they are capitalized or not capitalized, okay? Under, ano ba yun? Upper and lower case, ganyan siya. The capital letters and the small letters are representing the flocculating units or the strength of that component of the vaccine. So kung capital siya, mas mataas. Kung maliit na letter siya, lowercase, then it's going to be lesser flocculating units. Now, Tdap is Tdap for patients who are 11 to 12 years old, mga adolescent group na yan, no? This person should receive a single dose of Tdap. Okay, so kasi meron tayong DTaP, capital D, capital T, small a, Okay, ito ang sinasabi ko, Tdap, ha? Tdap for persons 11 to, this is available in the Philippines as Adacel or Boostrix. Okay, so Tdap for persons 11 to 12 years old, dapat mag-receive sila ng single dose of Tdap. Okay, to ensure continued protection against tetanus and diphtheria, one booster dose of either Tdap or TD should be administered every 10 years throughout life. Yung TD lang naman talaga ang kailangan natin, kaya lang wala namang mabili sa Pilipinas, no? So we will have to make do with the DTaP. So every 10 years siya. So mag-uumpisa siya ng every 10 years ng 11 to 12 years old. So kahit na nag-booster na siya ng DPT niya, nung bata pa siya, nung infant pa siya, pagdating niya ng adolescent age, that patient should start receiving Tdap and every 10 years thereafter. Now, if the patient is already 19 years old or older, so kasama tayo dyan sa and older, regardless of the interval since their last tetanus or diphtheria toxoid containing vaccine, these persons who have never received a dose of Tdap should receive 1 dose of DTaP. So kung halimbawa nung maliit tayo, nakareceive tayo ng DPT, nag-booster tayo after 1 year, okay? Tapos nagkasugat tayo siguro 2 years ago, okay? Nabigyan tayo ng tetanus toxoid, okay? Or for some reason, nabigyan tayo ng DTaP, okay? Dapat makareceive pa rin tayo ng at least 1 dose of Tdap and then follow this every 10 years thereafter. Okay? Parang ganun siya. Ngayon, kung hindi mo na matandaan, naku, kailan ba ako nabigyan o nabigyan ba ako? Pero alam mo nabigyan ko kahit hindi mo na alam. Basta sigurado na lang, magbigay ka na lang. It's better for you to take a Tdap because as far as immunization is concerned, kung sosobra, wala namang mangyayari, nagastusan ka lang, but at least you're sure. Again, for this age group of 19 and above, if naman never been vaccinated, kasi kanina na-vaccinate naman siya, if never been vaccinated against pertussis or tetanus or diphtheria, this person should receive a series, so parang nag-uumpisa sila, a series of 3 tetanus and diphtheria containing doses, and at least one of them should be Tdap. Kasi kung may available na TD, pwede naman yung dalawa, TD, tapos yung isa, pero yung isa dapat Tdap. Kaya lang, wala nga tayong available sa Pilipinas na TD or DT, so no choice tayo but to give Tdap for 3 doses. Okay? And the schedule is 0, which is your elective date, 1 month after, and 6 to 12 months after. Okay? We're always counting from the first injection. Okay? So hindi ito 6 to 12 months after the second injection, ha? 6 to 12 months after you always count starting from the 0 injection. Okay? Ngayon, kung halimbawa available pala ang TD sa Pilipinas, yung una nating ibibigay na dose should be a Tdap preparation and then later on yung TD for the second and the third doses. But again, I repeat myself, this is not easily available in the Philippines, so ang choice lang natin is to give Tdap for 3 doses. Now, DTaP catch-up. If a person is aged 7 to 9 years old, okay, and have received a dose of Tdap as a part of the catch-up series, an adolescent Tdap dose should be administered at age 11 to 12 years old. So in other words, nung bata siya, nabigyan siya ng DPT 1 and 2. For some reason, nagkalimutan na hindi na nabigyan ng booster. So pagdating niya ng school, tinatanong yung bakuna niya. So 7 to 9 years old na siya ngayon. Okay? So kailangan i-catch up mo yun. Kailangan makumpleto mo yung primary series. So you have to give this patient 7 to 9 years old the dose of Tdap as a catch-up. Pero kahit naka-receive na siya at 9 years old nung Tdap, which is equivalent to your third dose of the primary series, kasi dalawa lang nung baby siya, okay? Dapat maka-receive pa rin siya ng adolescent dose niya between 11 to 12 years old and then every 10 years thereafter. Okay. Now, kung nagkataon na inabutan na natin yung bata ng 10 years old na siya or older, tayo na halimbawa yun, okay? Who receive a Tdap dose, kung halimbawa binigyan mo 10 years old na yung bata, binigyan mo siya ng Tdap ngayon or tayo mismo binigyan ka na ng Tdap ngayon, hindi ka na mag-ulit ng mo. Ang gagawin mo na lang, regardless of your immunization history, then it's going to be given, your Tdap is going to be given 10 years na lang after. And every 10 years kung hanggang buhay ka. Okay? Now, if inadvertently nabigyan ng, okay, kanina TDAP ha, TDAP. Ngayon DTAP na siya. So, if inadvertently hindi sinasadya or nagkamali ka, nabigyan mo ng DTAP, akala mo pwede, okay, pwede naman yan. Persons 7 years old and above, hindi kasi sa kanila sana binibigay yung DTAP. Hindi naman sila mamamatay, pero hindi kasi yon ang appropriate na ano mo, kasi the chances of you developing diphtheria and pertussis would be lesser, no? Kaya yung TDAP ang preferred, di ba? Yung TDAP mas small d and small p yon. Pero kung halimbawa, hindi nga siya indicated, pero naibigay mo siya, either nabakunahan na pala siya dati o hindi, okay na rin lang. Okay? But if the DTaP is administered inadvertently to a 7-year-old patient or older, pero fully immunized na pala siya. Okay? So, ibibigay mo an adolescent dose should be administered. Ibibigay mo pa rin siya ng adolescent dose niya at 11 to 12 years old. So, kahit na pang-4 na yun o pang-5, nagkamali ka kasi ng bilang. Okay? Tapos nabigyan mo siya ng DTaP. Still, you're going to give the patient TDAP at 11 to 12 years old. No? Kahit naka-receive na siya ng Now, kung naman halimbawa baliktad naman, ang pasyente mo na 7 to 9 years old ay under-vaccinated. Okay? Kulang-kulang ang bakuna niya. Kanina, fully vaccinated na siya, pero nadagdagan mo yung bakuna. So, eto naman, hindi naman talaga, kulang talaga ang DTaP vaccination niya nung bata siya. Okay? If you are able to give the patient TDAP, whatever the TDAP that they're going to give for this patient will be the catch-up. So, kung isa lang yung DPT niya nung maliit siya, pag binigyan mo siya ng 2 DTaP between 7 to 9 years old, that will not be counted as your booster. That will be still counted as your primary series, and then you have to give your DTaP dose at age 11 to 12 years old. Okay? Now, if the DTaP is administered inadvertently naman, to under-vaccinated pa din siya, pero inadvertently given to a person 10 years old and over, okay, itong binigay mo na to is already considered as your DTaP for your, it will be equivalent for your adolescent dose na siya. Okay? So kahit na DTaP yung binigay mo sa kanya, pero 10 years old na pala siya and older, sige, pwede na rin yan as the adolescent dose. You don't have to give at 11 to 12 years of age. Now, patandain naman natin yung pasyente. So the person is now 7 to 10 years old. If fully vaccinated, the child between 7 to 9 years old receives TDAP. And the TDAP dose should not be counted as valid. Okay? So, ibibigay mo pa rin yung 11 to 12 years old. I think this is the same slide as the other one, no? So, kahit na sumobra siya, ibibigay mo pa rin yung TDAP dose mo sa adolescent dose. Now, the TDAP for pregnant women. Walang pagbabago sa recommendation ng TDAP immunization for pregnancy. Ibibigay mo pa rin siya at any time of the trimester. Okay? So, all pregnant women should receive 1 dose of TDAP for every pregnancy. So, kung nabuntis siya ng January, nanganak ng 10 months later or 9 months later, tapos nabuntis siya ulit ng November or December, bibigyan mo ulit siya ng TDAP. So, for every pregnancy. And you can actually give your TDAP at any trimester. Okay? Walang problema sa kung first trimester, second trimester, or third trimester. Okay? Pinaprefer lang nila yung 27 to 36 weeks because by this time, the pregnant woman would have been more comfortable with her pregnancy. Kung nagsusuka man siya, usually the vomiting is less settled here. All the discomfort of pregnancy will be more settled. But actually, you can give it anytime. So, if I will summarize the recommendation of the vaccines for pregnant women, hepatitis B vaccine can be given for pregnant women in all trimesters. Anti-flu can be given for women also for so hepatitis B and influenza and even tetanus can be given for pregnant women without fear of teratogenicity and can be given anytime during pregnancy. Basta remember lang na ang anti-flu inactivated, ha? All right. Oh yes, so this is from abroad, so just telling you that the Adacel and the Boostrix, which is also available in the Philippines, is the brands used are the brands we use for Tdap. Okay, this is actually one of our favorite charts for tetanus prophylaxis. This is not new, but I always want to show it so that if only to emphasize that not all patients need tetanus prophylaxis for wounds or even for animal bites. Okay, so this is available in the internet. Just type tetanus CDC tetanus prophylaxis and then it will be all over the place. Okay, so yan siya. So isa-summarize ko. So actually, the two charts, sinamarize lang dito. So the first thing is, classify first if the wound is a clean wound or a minor wound or whether it's another wound, okay? Other wounds. Okay, so when in doubt, classify them as other wounds. And then ask the patient, how many doses of tetanus prophylaxis have they received in their lifetime, whether in the form of DPT or DTaP or pure tetanus toxoid. Okay? And then that will determine whether kailangan pa ba niyang kailangan pa ba magbigay ng tetanus immunization o hindi na. And if you're going to give, are you going to give tetanus toxoid or are you going to give also tetanus immunoglobulin? Okay? So, andyan yung chart na yan. So, please look it up in the internet. Just type CDC recommendation for tetanus prophylaxis and wound management, and then different charts will be there and explanations for the footnotes are there for the modifications of recommendations. Okay, eto lang, I came across this for the essential drug list in the internet. Okay, there are many ways of giving your tetanus immunoglobulin na equine. Okay, yung sa human standard yun eh. Human tetanus immunoglobulin for both children and adults are given at 250 units per dose for one dose only. Okay, so it doesn't matter whether you're a child or an adult. Pero sa ATS, ang gulo-gulo niya, ang dami-dami ng recommendations. So if you will see the internet, merong 6,000, may 4,000. But this site actually gives us a very simplified way of giving your tetanus anti-serum, okay, na equine. So for all wounds, less than 24 hours, 1,500 units for both children and adults, and 3,000 units for anong tawag dito, for wounds for children and adults who have wounds that are more than 24 hours. Of course, the modification nito, kung halimbawa stab wound siya or napaka-dirty na wound yan, galing sa gera or something na ganyan, then you will probably need more. Okay? Pero sa ordinary wounds natin, 1,500 for wounds less than 24 years old, 24 hours, and 3,000 for wounds more than 24. Sa HPV, okay, I wasn't really going to include this, but now that it's here, okay, just to note that aside from the ones that you already know, just to remind you that we already have an HPV that contains 9 strains, and not only are they indicated for cervical cancer prevention, but also for anal and rectal CA. Okay, the meningococcal vaccine, this is not available in the Philippines, but we might have an equivalent brand here, okay, that will contain the serogroups ACWY. So they're now saying that in April 2020, I'm sorry, I forgot the date, so April 2020, it is now approved for use in children and adults 2 years and older, okay? And booster doses are recommended, okay, where needed. But of course, these are not routine vaccinations. If there is no exposure, then you may not need to have to give this to your patients. Hepatitis B vaccination in diabetes. Of course, diabetic patients are a special population. They say it's a shared decision-making because it may not be mandatory. Some sectors will say it is not mandatory to give hepatitis B vaccination in diabetes. Some would feel that because diabetes is an immunocompromised state, then hepatitis B vaccination should be recommended. So whatever the doctor feels, then it has to be a shared clinical decision-making for your patients. I personally recommend hepatitis B vaccination to my patients who have diabetes, especially when they have CKD, and most especially when they are having dialysis. Okay? So it's a shared decision-making. Ayaw ng pasyente, wala tayong magagawa. But hopefully we would be able to convince our patients. So shared decision na. So it's a bit hindi stricto, but kung gusto ng pasyente. Now, we have a combined hepatitis A and B vaccine. This is available as Twinrix, okay? So, you know that if hepatitis A is given alone, you only need 2 doses, 1 primary dose and a booster dose at 6 months. But if you're going to use the Twinrix or a combined vaccine, mapapahalo na siya dun sa hepatitis B recommendation ng 3 for the primary series. But again, all right, for patients with diabetes, it's going to have an accelerated schedule of 0, 7, and 21 to 30 days, not months or weeks, ha? 0, 7 to 21 to 30 days, which is of course within the month tapos na yung primary series mo, and then a booster at 12 months. Okay? Now, herpes zoster vaccine. Okay, in our lecture for immunization last year, in the last year's convention, we presented to you two brands of vaccine that are available, Zostavax and Shingrix. Although the Shingrix is not available in the Philippines, okay? Recombinant yan eh. Okay, yung Zostavax mo, yun ang available sa Pilipinas. Zostavax is given a single dose, and then the Shingrix is given as a 2-dose vaccine at 2 to 6 months interval. Dati, last year, doon sa immunization schedule ng CDC, you can either use the Zostavax or the Shingrix. But this time, okay, yung ipapublish nila na 2021, you will not see the Zostavax anymore, but what you would see is the Shingrix. Why? Because the Shingrix is actually a recombinant inactivated. Okay, the Zostavax is a live attenuated zoster vaccine. So they would prefer to use the recombinant over that of the attenuated live attenuated. Okay, the pneumococcal conjugate vaccine, which of course you know is the PCV14, dati kasi hindi siya recommend, wala siya, verbally lang nila recommend, but it was not in the chart. But now they are now including the PCV14 or the pneumococcal conjugate vaccine, especially for patients age 65 and older. But of course, for high-risk population, binibigay yan. Pero kung optional lang siya sa age 65 and above, okay, but this is going to be a shared decision-making. But take note, giving PCV14 does not preclude the giving of Pneumo23 doses 1 and 2. Okay, we mentioned earlier about pregnancy, what vaccines we can give our patients. So we can give the pregnant woman DTaP vaccinations, hepatitis B, and anti-flu inactivated. Please do not give active immunizations, okay, that are live attenuated, okay, especially human papillomavirus, the MMR, or the MMRV, okay? We do not give that to pregnant women. Now, eto na siya. Okay, sa mumps vaccine. The current routine recommendation for mumps or MMR for that matter is 2 doses, no? Diba? 1 below 4 years old and the second dose at 4 years old and above. And if you're giving the first dose at 4 years old, hindi na tayo maggawa ng MMR2, diba? But this is the recommendation for the general population only. Meaning, isang update nila dito sa recommendation, if, let's say, even if a patient has received 2 doses of mumps in the MMR, either as mumps or as MMR combination vaccine, when there is an outbreak, okay, they are still recommending giving a 3rd MMR dose during or just about the time of the outbreak. So I repeat myself. We only recommend 2 doses of the mumps vaccine. 1 is given before 4 years old, and the second dose is given at 4 years old. If you're giving the first dose of mumps vaccine at 4 years old, you don't have to give mumps number 2, either as mumps alone or as MMR. But if there is an outbreak, a 3rd dose of mumps virus can be given to the patients even during the outbreak. If a pure mumps vaccine is not available, then you can use the MMR. Now, if you're going to give the 2 doses of, this is one recommendation that if you're giving now the first dose of your MMR vaccine and the varicella vaccine, and the age of the patient is 12 months to 47 months. So 47 months is equivalent to, I think, 3 years old and 11 months. They feel that it is better to give the MMR vaccine separate and the varicella vaccine separate also. Okay? Pero ang precaution lang naman dito is if the family has a history of seizures, mga ganyan, okay, so they prefer this so that you can first test the whether the patient will have seizure or not. But if you don't have that concern, of course, you can use the MMRV combination. But if you do use the MMR vaccine and the varicella vaccine, sa second dose, pwede na siyang MMRV. But if you have your first dose is already at 48 months, so that is exactly 4 years old or older, then you may want to use your MMRV na. Okay? Again, I repeat, the 2021 updated immunization schedule, yung mga tulad ng mga charts na pinesent natin last convention, is not yet available, unfortunately, at the time of my presentation, but it should be available sometime in the end of February. I guess that is the last slide. Okay, so if I may borrow what Louis Pasteur has said, when meditating over a disease, I never think of finding a remedy for it, but instead a means of prevention. And of course, vaccination is one very, very powerful way of preventing disease. And if I may share a personal quote, which I also showed you in the previous presentation, I strongly believe in this, that understanding the principles of immunization helps us put our resources, this time our vaccines, to good use and, therefore, provide our patients the better, if not the best advantage to fight disease. Thank you for your patience, and I hope that we are all united in preventing diseases, especially vaccine-prevented diseases, by knowing and understanding the principles and the concepts and even the recommendations for immunization. Thank you and have a good day.